I'm Viral Shah. I'm an associate professor here at the Barbara Davis Center for Diabetes in Colorado in US. I will share this patient case with you. And I deliberately selected an imperfect case here because sometimes in a meetings or when you are presenting your case, you're gonna really talk about the nicest patient that you have. No, he's a nice guy, don't take me wrong, but at the same time, he was not perfect in managing his type 1 diabetes. And I selected that case here to present amongst you. So this is a 54-year-old gentleman with 20 years of type 1 diabetes. So that's a long-standing diabetes with A1C of 7.7 at the time we enrolled him in an Omnipod 5 study. He was on a multiple daily injection with continuous glucose monitor. He was actually using the Dexcom G6, but with injections. He was on insulin glargine, 38 units per day, and Lispro, about 15 to 20 units per day, depending on his meal. He is not counting carbs. He's just guessing that this requires 15 units or 20 units, and he will deliver that insulin through injection based on his guess. But he was very consistent doing that for 20 years successfully. So I wasn't super concerned about that part. Now, some people do think that the carbohydrate counting is essential for an automated insulin delivery system. In my opinion, it's not essential, and that's why I selected this patient here. Unfortunately, his BMI greater than 30, so he was dealing with insulin resistance. And you can see here that this is a 2-week, that's a 14 days of a snapshot of his glucose data from Dexcom G6. You can see that 70 to 180 milligram per deciliter line, which is 3.9 millimole to 10 millimole per liter. There are a lot of hyperglycemia and hypoglycemia, and I was more concerned about the hypoglycemia. Look at that. Each box here is each individual day, and he is spending a lot of time in hypoglycemia every single day. And you can see here clearly that hypoglycemia is followed by hyperglycemia, and that's what happens, right? When you see all these people with type 1 diabetes, they freaked out when they have hypoglycemia, and then they drink a lot of juice, eat something, and then there will be a rebound hyperglycemia because of all these factors. And then it's like a catch, it's like all this kind of a catch-up game that hypo and hyper all the time. And that's what this guy was dealing with for almost 20 years in managing his type 1 diabetes. So how I did when we transitioned him from a multiple daily injection to the Omnipod 5, I actually did a direct transition. I gave you some idea that during a clinical trial, we were given an option and a flexibility that either we can train the patient on insulin pump itself or the AID system. It was at the investigator discretion. For this patient, I directly jumped into the automated insulin delivery system without training him on a pump. And in my opinion, it's pretty safe to do that. I set up his basal rate as a 50% of total daily insulin, which is about 40 units per day. Remember that it only matters for the first port. After that, it doesn't matter. So don't pay much attention in setting up the perfect basal rate for your patients when they are choosing Omnipod 5 AID system. I set up insulin to carb ratio because you have to set up something in the system, right? But this patient throughout the trial has never counted carbs. He just took the boluses based on his guess. And I'm totally fine with that as long as he's doing it consistently. We set up a correction by using this formula, and I did a target glucose of 110 milligram during the daytime. He was a little bit concerned about having a hypoglycemia at night, so we set up at 120 milligram per deciliter at night initially. But then after 1 week, he was fine in changing that to 110 milligram per deciliter, and we changed that all target glucose to 110 milligram per deciliter. Now on the top panel, you can see that this was his baseline CGM data. Again, I mentioned that time in range was about 70%, but look at the time below range, which is time below 70 milligram per deciliter or 3.9 millimole per liter. About 10% of time, that's a lot of time he was spending in low blood glucose. After Omnipod 5, you can see that the major improvement he noticed is that hypoglycemia almost gone from almost 10% to less than 2%. That's a remarkable improvement in hypoglycemia. So he's now not spending those time in hypoglycemia and spending more time in range. And you can see that time in range has improved to almost 80%. So that's a significant improvement in time in range. Now, Is this system perfect? No, the answer is no. None of the automated insulin delivery system is going to be perfect. You will still see some postprandial spikes, particularly if the patients are missing their meal insulin, or if they're not counting carbohydrates or something goes wrong, right? So this patient is still having some highs, but you can really appreciate that the spike of the glucose and the duration of those spikes have gone down significantly. So now he's spending more time in a range, less in hypos and less in hyper, which in fact is translated into the A1C. And his A1C was 7.7% at the beginning of the study, dropped to 6.7 and 6.9 during the extension phase. And that's what you expect when there is an improvement in time in range and reduction in the hypoglycemia. Now I'm going to just give you a long-term follow-up of this individual. So I just looked up in my electronic medical record system. So this patient was seen by me again in September of 2022, so just a few weeks before, and now he's using the system for 2.5 years, and his A1C at last visit was 6.7%. 6.7% after 2.5 years of using Omnipod 5. Time in range of 75%, so he's maintaining time in range, and time below range was 0.6%, which is almost like zero. So in a nutshell, over 2.5 years, this individual had a significant improvement in time in range, significant reduction in time below range, and of course, this is all going to be translated into the better quality of life. So in summarizing my case, I think this patient that I highlighted you here is that transition from a multiple daily injection to the Omnipod 5. So the people who do not have any experience of using insulin pump, you can still transition them to the Omnipod 5 very safely. The system does improve the time in range and A1C, and also reduces the hypoglycemia for individuals who have a lot of hypoglycemia at baseline. And in my opinion, AID should be offered to every individual with type 1 diabetes if they want to be on AID system, regardless of certain characteristics. Like for example, even though if they don't count the carbs, I think the system is still